Hello, ladies and gentlemen. I'm delighted to be here to speak to you this afternoon, and thank you to Dr. Hay for giving me the opportunity. So I'm going to talk to you about Fujifilm's vision for AI more broadly in healthcare for 2020 and beyond. And I'm going to start with our journey that we began nearly 70 years ago in informatics and AI, when in 1956, we developed the Fuji-C, which was the first electronic digital computer in operation in Japan to perform complex calculations for lens design. And then in 1963, we digitized X-ray film with the FCR. Skip forward over 30 years, and we began our journey in machine learning when we developed image intelligence for facial recognition. Either knowingly and unbeknown to you, many of you will have used this technology in your consumer cameras over the years. Now, Fujifilm's philosophy is to create proprietary technologies, but also to create new value in new markets by repurposing technologies. And it was in 2007 that we repurposed machine learning, our machine learning technology and our know-how, and applied it in image intelligence to medical imaging products within our radiology and medical informatics organisation. This culminated in 2018 with an idea that we call as Riley. And Riley uses all of our capability and know-how in not only in the machine learning, but it's a deep learning platform. It's not a product, it's an idea. It's a deep learning platform that we can use to integrate in all of our medical solutions within our organisation and across the world. And I'm just going to introduce you to Riley.
I am Riley. Ever since I was born, I've been involved in the medical field. I know you never see me, but I am around when you're helping, saving, and bettering people's lives. My mission is to be as good as I can be to help and better the work you do. I'm not one to improvise nor think outside the box, but you can count on me to be immaculate in all that I do. I may be overly detailed and precise, but I hope that you can appreciate that meticulous side of me. I never sleep, so I am good to go day or night and deal with a whole lot of information. There is so much to life. Thus, my mind is open to learn from all minds to consolidate that knowledge to share with all. I know you don't see me, but I exist in what you do. My wish is to better the world through your patient care. I am here, invisibly.
So all of this has been possible through our continuous investment in AI technology across our holistic platform for healthcare in both radiology, IVD, and more recently endoscopy, and has been possible through the development of one of the world's most powerful deep learning machines, the Fujifilm brain, which resides within our creative centre. Now, our approach holistically again within healthcare is threefold. The first is segmentation, so anatomical segmentation and recognition. Second is computer-aided diagnosis, or CAD, for automatic lesion detection and measurement. And the third is workflow and reporting, and the integration of these three things into clinical systems. So from a patient point of view, it's to integrate this into the entire workflow. And these are just some of the areas where we've already commercialized AI into areas in which we operate, and some still under development, with Riley at the center. So why are we doing this? Specifically for endoscopy and for gastroenterologists. When I'm out visiting hospitals in the UK or in Europe, these are some of the many of the things that I hear regularly in hospitals. I also hear them at conferences like this. I read these things in journals. And the challenges that continue to exist despite industry, ourselves and our industry peers trying to solve them through new medical devices. Lack of resource and skill set. Patient cohorts increasing due to sensitivity of fit. A fragmented diagnostic workup. Quality of life following radical therapy as a result of not finding lesions or pathology early enough. Patient survival. Workload and cost of histology. Unnecessary therapy. Learning curve and access to new therapies, new devices. Endoscopist fatigue. Missed lesions. Cost of surgery. Chemoradiotherapy. And aftercare of colon cancer. And so specifically for endoscopy, there are things we can do with AI, and we've heard already from industry peers and colleagues that there's a number of different technologies out there that are either commercialized or being commercialized. And for endoscopists, the obvious one is detection, increasing adenoma detection rate, and the second thing is characterization. And so for these three stakeholders, the endoscopist, the healthcare provider, and the patient, we can either directly or indirectly start to resolve some of these challenges that we've failed to resolve so far through other medical devices. So improvement in adenoma detection rate, reduction in radical surgery, chemoradiotherapy, complications and aftercare, increase in organ-sparing treatment, improved quality of life and improved 5-year patient survival. And then moreover, with regards to characterization, and there's the question and the debate been going on now for a few years around discard or diagnose and leave. We can unlock resource and improve operational efficiency. We can reduce cost associated with histopathology, and we can potentially get faster results, prognosis and access to treatment. And the overarching thing is we can empower endoscopists and provide support for them to resolve some of these issues that I just talked about. Now, all of this is possible through the platform Riley. As I mentioned, Riley isn't a product, it is a development platform, and today we're exclusively launching for the first time our endoscopy AI product. Professor Neumann will talk more about that later, so I'm not going to introduce that now. I'm just really focusing on our vision. So, in summary, our vision goes much beyond endoscopy. If we think about the rise in the multidisciplinary approach within healthcare, with any particular discipline, our approach is all-encompassing. So it's comprehensive and holistic. Our vision is to empower healthcare professionals with Fujifilm's idea Riley to solve some of these challenges and ultimately improve the patient experience, outcomes and care. Thanks very much for your time.